Hey everybody, Foley Fitness here, the place where we talk all things lower back pain, prevention, and management. And today's topic is spondylolisthesis. Everything you need to know and what you can do to help relieve and prevent worsening symptoms. Spondylolisthesis refers to the slippage of one vertebrae over top of another one. This slippage is most commonly seen as a result of congenital defects in the back of the vertebra, so it means you were born with it, or degenerative changes as a result of age or excessive extension. Excessive extension related injuries are often seen in sports like gymnastics, football, and wrestling. And now for the good news. There is a lot we can do to help both prevent worsening symptoms and relieve or eliminate current symptoms. But before we can do this, we need to understand exactly what we're trying to prevent and why we're trying to prevent it. As previously mentioned, spondylolisthesis is the slippage of one vertebrae over another. In the case of congenital defects, we often see the facet joints with a slight forward displacement, and this will predispose you to further slippage as you age. Now, in the case of age-related degenerative spondylolisthesis, we have the joints and ligaments of the back of the vertebrae. Again, we have the facet joints implicated, are often the issue. And over time, these joints get more wear and tear from past injuries and just use, and they can become relaxed. And once they become relaxed, they can no longer stabilize the disc or the vertebrae, and it starts a forward slippage as well. The problem here is that the more the vertebrae slips forward, the less room our spinal cord and nerve roots have to move around. And this compression can cause pain, numbness, tingling, all the symptoms you may be feeling. And finally, with spondylolisthesis related to excessive extension, we see the pars interticularis bone here. When this comes under excessive stress for prolonged periods of time, it can fracture or break. This will significantly reduce the amount of stability in the back of the spine or in the back of the vertebrae, and this will allow slippage forward. Now, the common denominator between all three of these issues is that there is an inability of your spine's joints and ligaments to effectively stabilize your vertebral column. Now, the way that we can add this stability back to the spine is by following these three steps. Number one, we need to identify your exacerbators. So what movements, what postures, what loads are irritating your lower back? Number two, build support systems around the movement, postures, and loads that you found to be irritating. And last but not least, we have build an exercise routine that reinforces your support systems. All right, now let's take a closer look at each step. So for step one, we need to start by taking a closer look at your daily movement patterns. To help make step one a little simpler, I have a list of things that generally irritate people with spondylolisthesis, and that would be heavy lifting, quick movements, hard landing, bending, and certain sleeping positions. But keep in mind that was a very general list, and each case is unique. So don't be surprised if you have more or less irritants. But regardless of the irritants that you have, it is imperative that you document everything. The dates, the pain, how much it hurt, where it hurt, did it radiate? All these things are going to point us in the right direction and tell us if what we're doing is working. Next up is step two, building support systems. To make this easy, we are going to create some support systems around the previously mentioned general irritants for spondylolisthesis. All right, so let's start off with bending and heavy lifting. Now there's two things right off the bat that we can do to help with bending and heavy lifting, and that is going to be bracing the core and hinging from the hips. You see, bracing the core is how you use your body's built-in lifting belt, and learning how to hinge from the hips is going to further offload the spine and put more of that stress through the legs and hips. All right, for the abdominal brace, all we're gonna do is make two thumbs up and stick them into either side of our obliques and push in about a ½ an inch. Now from here, we are going to push out using our core muscles. That is the abdominal brace. However, we need to make sure that we are toning the abdominal brace to the activity. So if you are picking up a super heavy object, then we're gonna wanna have a nice dense brace. However, if you're gonna go pick up something light like a pencil or something, we don't want to just be squeezing as hard as we can, because this squeeze does still put a little bit of compressive forces on the spine, on the discs, so it's not a good idea to always be fully flexed. Now for the hip hinge, there is 4 things that we want to remember. Having a relatively squared up neutral stance is ideal. However, this is going to vary depending on the size of the object that we're picking up. So just as a general guideline, neutral stance. Now for the knees and the hips are going to work together. So we're going to pretend that there's a rope going through our belt buckle and it is pulling us directly backwards. Instead of initiating from the lower back, we are going to be initiating from the hips with the knees to follow. Now, while we're doing the hinge movement, we want to keep a slight brace in the core, and this is going to help us stay in the upright position, which is the last step, is making sure that our shoulders are nice and tucked and the head is not jutting forward. So we're going to have the head, shoulders, core brace, hinge from the hips, bend at the knees, and neutral stance. Now, does every bend have to be absolutely perfect? No. We can definitely get some variance, but to know how to bend efficiently is going to be good for when you have to pick up those super heavy items. Next up, we have hard landings and quick movements. Now this one can get kind of tricky because it largely comes down to the severity of your specific spondylolisthesis. So this is something you're probably going to want to consult with your doctor about. However, starting with a slow, progressive, pain-free walking routine can be a wonderful place to start. And a quick tip for the walking regimen, your main goal should be staying underneath of your pain threshold. And to help with that, we need to start off walking slow with predetermined distances. Do not make the mistake of having a great walk, feeling wonderful, and then the next day tripling it, because that is going to put us close to passing that threshold. Because that's an easy way to take 2 steps forward and 3 steps back. Next, we talk excessive lumbar extension. Excessive extension can be a tricky one as well, because oftentimes we don't really notice that we're doing these little movements that are irritating us throughout the day until we pass the threshold. So the first places we're going to look are postures and positions held for prolonged periods of time. These postures and positions are often found in occupations with a lot of sitting, repetitive movements, or bending. Now, once we find this irritant, we have 3 options. We can reduce, modify, or eliminate it. An easy example could be you are a nurse whose job requires a lot of heavy lifting and frequent bending. And in this example, bending over was one of the irritants that you found. So 1, can we eliminate it? No, that's how we get paid. 2, can we reduce it? Maybe, maybe not. It depends on your work schedule. And 3, can we modify it? Yes. So in this example, for the nurse to modify bending, they would learn how to appropriately brace their core to help stabilize the spine and hinge from the hips to take some of that load off the spine and put it into the legs. And this is the process of how you would slowly improve your spinal hygiene. And last but not least, we have sleeping positions. Now, there's generally 2 positions that are going to feel relatively good for most people, and then 1 that we're definitely going to want to avoid. All right, first up, for our position to avoid, we have stomach sleeping. This one is going to irritate most spondylolisthesis cases because we have a lot of excessive extension here. And if we also have a big pillow combined with that, that's going to further push us into extension, and that will likely irritate you. All right, now for the positions that will likely give you some relief. We're going to start with back sleeping. Now, this one can still cause a little bit of discomfort, so here's 2 things you can do to kind of help out with that. Now, the first thing we can do to help with this discomfort is reduce the amount of extension in your spine when you're laying. Now, even when we're flat here, sometimes we can get a pretty decent curvature here, and that can irritate us over the period of the night. So a way that we can kind of get rid of that is we can put both legs up here and put your hand in your lumbar curvature. And as we slide our hands down all the way to the end of the butt, we're going to be pushing our lower back into the bed segment by segment. And when we get all the way to the end, we're going to have a nice and flat back, and then we're going to lay the legs down. And for the second thing to help get rid of some of that extension, we can put a pillow right underneath of our knees. And pro tip, make sure that you don't use a massive pillow, because the bigger the pillow, the more the legs are going to be up. And this is going to tighten the hip flexors, and when these get tight, it can increase lower back pain. So really, you should just be sticking with a small to medium pillow. And last but not least, we have side sleeping. All right, first up, we have the neck and leg position. Starting with the neck, we just want to make sure that we have a nice medium to small size pillow that helps keep our neck in a neutral position. Having a pillow that is too big is going to put our neck into lateral flexion, and this will encourage the lower back to also go into some lateral flexion, whereas a neutral spine would probably be the most ideal. And now for the legs, what generally feels best is having a slight bit of hip flexion, but two problems that we can run into is one, if we have the legs too far flexed, this is going to be really shortening the hip flexor muscles, and that can put more stress on the lower back as they get tighter and tighter. And the second issue we run into is having one leg come over the other. This is going to put more stress on the hip flexors and tighten up the adductors, and this can be a problem as well. So to kill two birds with one stone, we can add a small pillow between your legs, and this will not only help your legs and hips stay neutral, it'll take stress off of the lower back. And then as long as our hip position isn't too far forward, we're golden. And one more tip for side sleeping, if you're somebody who has wide hips and a narrow waist, you can add a rolled up towel to the lower back segment, and that will help you stay neutral while you're sleeping. And finally, for the last step, we have build an exercise routine that reinforces the movement patterns and support systems that we just created. And for this, we're gonna go over my top 5 exercises that have the most amount of carryover to your daily life, starting from easiest to hardest. And number 1 is going to be knees to chest. 2 ways we can do this. One way is assisted by grabbing the back of our legs and pulling that to our chest so it's more of a stretch. And the second way is we can use our deep ab muscles to bring the legs to the chest. One thing to consider with this is that if you are in an extended position when you initiate the abdominals and the legs coming up, that can cause some pain. So for this, we're going to want to flatten the spine and then do the knee raise. And for number 2, we have pelvic tilts. This one is important because we are working our deep core muscles in addition to a little bit of hips, and we are exposing our lower back to very low load flexion and extension. Now to do this, all we're going to do is lay down with the knees bent. We are going to extend the spine, and then we are going to press the spine into the surface. Now this is going to lift the hips slightly off the ground. That's all right. And we're just going to want to do a few rotations of this, and that will help strengthen your core and maintain some spinal mobility. And for number 3, we have the cat camel. Now this one is debatably as easy as the last one. However, I think it's a good one to try out to see if it works for you. For the cat camel, we want to be in a quadruped position, so shoulders stacked over the hands and hips stacked over the knees. For this, we're going to expose our lower back into flexion and extension. Now, one thing to note here is that we are not trying to go into end range flexion or end range extension, meaning the farthest you could possibly go. We are just trying to enter into those realms and expose our lower back to both extension and flexion. And again, both of these movements are so relevant because we cannot lose that flexion and extension in our lower back. If we start to become robotic and unable to move in these positions, we are going to see a lot of problems down the road. For the bird dog, we're going to stay in that same quadruped position, shoulders over top of the hands and hips over the knees. Now, all we're going to do is we're going to extend one leg and the opposite arm all the way out. We're going to hold for 3 to 5 seconds, really emphasizing on the hips, the hamstrings, the upper back, and squeezing the fist. Now, one thing we want to look out for here is if we kick up, this is going to put our lower back into excessive extension here, and that will start to get painful. So we want to make sure we're kicking directly back, and this will help keep the spine nice and neutral. And finally, we have the dead bug. This is an excellent exercise for hip and core strength. However, we really have to make sure that we are keeping an eye on our spine position throughout the entire movement. So for this, all we're going to do is bring our legs to a 90-90 position and bring our arms straight over us. We are going to extend one arm and the opposite leg at the same time, similar to the bird dog. But one thing we have to make sure of with this is that while we have our leg extended, all this weight is either going to be on the core or on the lower back. So if we have the leg extended and we're not keeping a tight core, that's going to force us into an extended position, and under the load of the leg, that can be pretty painful. So we really have to make sure that we are emphasizing that core while we're doing this movement the entire time. All right, guys, I hope you got tremendous value from this video. If you have any questions or concerns, leave them down below and I'll get back to you. And as always, have a great day.